Now that we've shown you how to do an arm splint, we're going to show you how to do a lower leg splint. Once again, there's two bones in the lower leg, the tib and the fib, and we're going to show you how to splint those. Now, we spoke about with the arm splints about using newspaper, magazines, cardboard, a proper splint, whatever you got. There's another item you can use too called a SAM splint. These come like this. They're foam with aluminium in the middle. They're quite lightweight. They're quite versatile. You can bend them into any shape you want to, and they can cut them quite easily with trauma shears as well. This can be a leg splint, an arm splint. It's quite versatile. But what we're going to do today is show you how to do a leg splint. Now, the difference between a leg splint and an arm splint is an arm's in the air, so we can quite easily get a splint under the arm. However, the leg is usually on the ground. We can't get the splint under, so we're going to do it a different technique. So I'm going to get Taylor to hold the fracture site again, which we'll say the fracture site's here. So when Taylor holds the fracture site, we're going to get two triangle bandages, fold up like this again. We've got to get the triangle bandages under the leg first. So we're going to use the leg's natural contours, which is under the Achilles heel here and the back of the knee. So we can just slide this in a little gap there and slide up into position below the fracture site. And we can use this one to slide under the knee, again under the fracture site. If for some reason you can't get under the knee, you can do both from under the ankle to slide them both up. That's okay as well. Now, we have these in position ready to go. Next, we've got to get our splint under the leg, between the leg and the triangle bandages. Have our padding there as well. Now, the issue here is we've got to lift the leg up. This is going to cause your patient a lot of pain. Always be honest with your patient. If it's going to hurt your patient, say to your patient, this is going to hurt, because once you say it's not going to hurt and it does, you lose your patient's trust. So we're going to tell our patient this will hurt for a couple of seconds. Taylor, I'm going to count to 3, lift the leg up, I'll put the splint under. Okay, you ready? 1, 2, 3, and down 2, 3. Keep holding. I'll bring the hands out now. Hold the splint. So we've done it as seamlessly as possible. Once again, we're trying to do this bottom knot we did before. The loop over. One tail through the bottom, and then one tail down through the top. Slide this up and get the good purchase on there to bite it on there, like this, nice and tight. And then once again we can do our reef knot. Left over, right and under, right over, left and under. And now we're going to do the top one. Just move your arms forward there, Taylor. We can bring this up through there. Or this one down through the bottom. Pull it down, get our purchase there, and left over, right and under. Oops. And then right over, left and under. There we go. Once again, if you can't do that bottom, I'll just use a reef knot, put an extra turn in the bottom, the first turn as well. And there's our lower leg splint.